Elizabeth, having previously recovered from COVID-19, was shocked when she began experiencing symptoms of the virus once again. Despite her assumption that the threat of COVID had passed, she decided to seek medical attention at the hospital. Upon conducting some tests by her attending physician, Dr. Logan, she was tested positive for COVID, leaving her stunned by the unexpected recurrence of the illness.
What? Wait, hold on a sec. You're telling me I have COVID again? But I just recovered, and I've been diligent about getting vaccinated. How is this even possible?
I understand your shock and frustration. Unfortunately, the pandemic is still ongoing as we speak, and the virus is still spreading. While vaccines are important in fighting the virus, they're not 100% effective. In fact, there have been recent reports of side effects associated with certain vaccines.
Side effects? I haven't heard about that. What kind of side effects?
Well, one well-known vaccine, AstraZeneca, has been linked to rare but serious side effects. Not quite long, a man suffered a permanent brain injury due to a blood clot and brain bleed after receiving the vaccine. However, he's not alone, and there have been other reported cases too.
That's horrifying. I had no idea.
Yes, it's quite concerning. That's one reason why there has been a decline in demand for the AstraZeneca vaccine. Fortunately, the U.S. Food and Drug Administration, or FDA, and the European Medicines Agency have issued notices that the vaccine is no longer authorized for use, and AstraZeneca's vaccine is currently being withdrawn from the market. Thankfully, there are other effective vaccines available. On top of that, there's a new COVID variant called FLiRT that's been making headlines lately.
A new variant? What does that mean?
Variants are versions of the original virus that can have different characteristics, including how easily they spread or how severe the illness they cause is. The FLiRT variant is particularly concerning because it has been spreading rapidly, especially in the United States, and causing symptoms similar to those of the original virus, such as cough, fever, sore throat, and difficulty breathing.
OMG, those are some of the symptoms I experienced. Could I have contracted the FLiRT variant?
It's possible, but there are also other factors to consider. To prevent future infections, especially in elderly people like yourself who may be more vulnerable, I'll guide you through the 7 COVID protective measures to help protect you and your loved ones from the new COVID variant. These steps will help strengthen your defenses against the virus and reduce the risk of reinfection.
That would be incredibly helpful. I can't bear the thought of going through this again.
Ensuring good hygiene is important for fighting the spread of COVID. One of the key practices is regular hand washing with soap and water, which should last for at least 20 seconds, particularly after coughing, sneezing, or being in public spaces. This simple act effectively removes viruses and bacteria from your hands, significantly reducing the risk of infection.
But what if I can't wash my hands every time? There might be situations where water and soap aren't available. What should I do then?
In such instances, hand sanitizer with at least 60% alcohol is a reliable alternative. Make sure to carry it with you when you're out and about, using it frequently to disinfect your hands after touching surfaces or interacting with others.
I see. I actually have some hand sanitizers at home, courtesy of my son when I first contracted COVID.
That's perfect. You're already one step ahead. But remember, good hygiene goes beyond hand washing. Showering regularly, laundering clothes and linens frequently, and keeping living spaces clean are all essential practices. Maintaining proper hygiene is highly essential for reducing the risk of contracting COVID-19 or FLiRT.
I've always valued hygiene, but I'll make sure to be extra vigilant and stick to these practices diligently.
Excellent commitment. Another effective way to protect yourself and others from COVID is by wearing masks. They act as a barrier against respiratory droplets containing the virus.
I'm not a fan of wearing masks. They're uncomfortable, and I struggle to breathe properly when wearing them.
Understandable. But there are lots of comfy options out there. Look for masks made from lightweight, breathable fabrics. They'll let you breathe easier. Also, masks with moisture-wicking properties keep your face dry and comfy, even in warm weather or if you wear them for a long time.
Thanks for the tip. I'll look for those types of masks.
Anytime, Mrs. Elizabeth. Masks not only stop you from spreading the virus, but also offer some protection from breathing in infected droplets. Recent studies show that COVID can spread through tiny airborne particles, but masks help lower the risk by reducing the concentration of these particles in the air.
That's interesting. I didn't bring a mask with me today, but I'll grab some on my way home.
No problem at all. I've got you covered.
Thank you, doctor. I really appreciate it.
It's my pleasure, ma'am. Your health and safety are our priority. Now, when it comes to wearing a mask, it's important to also consider how you can limit your exposure to crowded places, large gatherings, and close contact with people outside your household. These precautions are important in reducing the risk of COVID transmission.
But what about shopping and errands? My kids are busy with their jobs, so I often find myself navigating crowded malls and grocery stores.
I completely understand it can be challenging, but there are safer alternatives you can explore. For instance, try to schedule your shopping trips during less busy hours, or take advantage of delivery services. These options can help minimize your exposure to crowded environments.
Oh, I hadn't thought about delivery services. That could really work for me.
Definitely. And when you do need to go outside, consider shortening the duration of your trips. This means spending less time in public spaces, which reduces the likelihood of encountering people who may be carrying the virus.
So, it's about being strategic with my outings and minimizing my time in crowded places.
Precisely. By taking these precautions, you can lower your risk of exposure to COVID while still managing your day-to-day activities.
Duly noted, Doc.
Another precaution to note when you do go outside is to maintain social distance. This means keeping at least 6 feet of space between yourself and others, especially in situations where wearing masks might not be possible.
Does this mean I can't socialize with my family and friends? I have a book club that meets every weekend. Won't it seem odd if I'm suddenly keeping my distance?
Not at all. Your loved ones should understand the importance of safety measures. Instead of indoor gatherings, consider meeting outdoors where there's more space to spread out. You can still enjoy each other's company while keeping a safe distance and avoid physical contact like handshakes and hugs.
Now that I've contracted the virus again, it feels like I can't go anywhere. I'll have to stay indoors until I recover.
Actually, you can still maintain connections with friends and family, even while indoors. Virtual communication tools like phone calls, video chats, and social media platforms allow you to stay in touch without risking further exposure to the virus.
I managed to overcome the virus once. I'm confident I can do it again.
That's the spirit. And to foster quick recovery, engaging in healthy habits like eating a balanced diet, staying physically active, getting enough sleep, and managing stress can help support your immune system and overall well-being.
I've always been a fan of healthy eating. Most of my diets include a lot of leafy greens, and I always consume fruits and drink enough water.
That's great. Incorporating a variety of foods into your diet is good. Along with leafy greens and fruits, try to include whole grains, lean proteins, cruciferous vegetables, and fatty fish. For the elderly, maintaining a nutritious diet is important for a strong immune system and reducing the risk of illness, including COVID.
I'll definitely keep that in mind. What about other factors?
Ensuring you get enough sleep is essential too. Get at least 7 to 9 hours of quality sleep each night to support your immune function. Managing stress is also important. Practicing relaxation techniques like meditation or deep breathing can help reduce stress levels.
All right, Doc. I'll adhere to these habits.
I'm sure you'll recover in no time. Another important procedure for reducing the spread of COVID is by regularly cleaning and disinfecting frequently touched surfaces, such as doorknobs, light switches, countertops, and electronic devices. This helps eliminate viruses and bacteria.
My son arranged for someone to clean my house daily, and I sometimes pitch in for a bit of exercise.
That's wonderful support from your son. Yet, cleaning alone may not fully eliminate bacteria and viruses from frequently touched areas. You should also try to disinfect. Disinfecting involves using chemicals such as bleach, alcohol-based solutions, or hydrogen peroxide, which can effectively kill the COVID virus on surfaces when used.
I find the smell of disinfectants quite overpowering, which is why I tend to avoid using them. I usually opt for dish soap instead.
When using disinfectants, it's crucial to ensure proper ventilation to avoid inhaling fumes. Also, follow safety precautions like wearing gloves and avoiding contact with eyes or skin. Cleaning and disinfecting should be done based on usage and contamination risk, with high-touch surfaces needing more frequent attention.
I'll make sure to communicate with my house cleaner to include regular disinfection in her cleaning routine.
A smart move. Prioritizing regular cleanliness and hygiene can minimize the risk of exposure to the virus and help you stay healthy during the pandemic. But aside from adhering to all these practices, staying informed about COVID and its new variant is equally essential.
I've always kept up with the news, but lately I've been feeling under the weather and haven't been keeping tabs.
It's important to stay informed during times like this. Guidelines and restrictions can change, so staying up to date helps you make informed decisions. And there's a lot of misinformation out there too, so knowing what's reliable is best.
That's true. In case of emergencies or if I need information, where should I turn to?
There are several reliable sources you can reach out to. The Center for Disease Control and Prevention, CDC, offers a wealth of information and resources on COVID, tailored for individuals, healthcare professionals, and community organizations. And of course, for emergencies, don't hesitate to call 911. If you need international assistance, the World Health Organization, or WHO, is a valuable resource as well.
Thank you, Doctor. After I recover from this virus, I'll be sure to stick to these procedures to avoid getting sick again.
That's a proactive approach, Mrs. Elizabeth. Taking steps to protect yourself before and after recovery is vital, especially given your immune system's vulnerability. We want you healthy and strong.
Thank you once again, Doctor. I really appreciate your guidance.
Due to Elizabeth's recent diagnosis and previous recovery, Dr. Logan recommended that she remain in the hospital for further observation and treatment to ensure her safety and prevent any complications. If you liked this video, please subscribe and watch more videos here next.